This video is for general information only and is not a substitute for personalized medical advice. Always speak to your GP or pharmacist before starting, stopping, or changing any supplement. Can you actually overdose on zinc? The short answer is yes, and it can occur, usually due to supplements rather than food. Zinc is something most of us don't think twice about. It's in multivitamins, cold remedies, immune support supplements, it's everywhere. And because it's essential for your health, it can feel like more must be better, but that's not quite how it works. Zinc is a trace element, which means your body needs it, but only in small amounts. It plays a role in immune function, wound healing, DNA synthesis, and cellular metabolism. The problem is the body has a limited capacity to handle excess zinc, and when levels get too high, things start to go wrong. There are two ways zinc toxicity can develop. The first is acute. That's when someone takes a very large dose in one go. The second is chronic, which builds up gradually over time through prolonged high-dose supplementation. With acute toxicity, symptoms tend to appear within hours. We're talking nausea, vomiting, abdominal pain, and diarrhea. These are the body's fairly immediate response to a large zinc load. Chronic toxicity is a bit more insidious. When you take too much zinc over a long period, it starts to interfere with your body's ability to absorb other essential minerals, particularly copper and iron. This happens because zinc and copper compete for absorption in the gut. Over time, this can lead to copper deficiency, which in turn can cause anemia, a reduction in white blood cells called neutrophils, and in more serious cases, neurological complications. So it's not just about the zinc itself, it's about what excess zinc does to the balance of other nutrients in your body. Now, where does the risk actually come from? In the UK, most cases of zinc overdose are linked to supplements, not food. The risk rises when people are taking multiple products at once. A multivitamin here, an immune booster there, a cold remedy on top. Without realizing how the zinc content adds up, there is an established upper intake level for adults, and a pharmacist or your GP can advise what's appropriate for you. As a general rule, avoid taking multiple zinc-containing products at the same time unless a healthcare professional has told you it's safe to do so. If you're currently taking zinc supplements, especially at higher doses or over a long period, it's worth having a conversation with your doctor or pharmacist. They may recommend blood tests, including a full blood count and copper levels, to check that everything is in balance. If you're thinking about starting zinc supplements, or you're unsure whether what you're already taking is right for you, please speak to a healthcare professional before making any changes. They can help you work out whether supplementation is necessary and guide you on the right approach for your individual circumstances. On the safety side, if you think you've taken too much zinc, or if you develop symptoms like persistent vomiting or severe abdominal pain after taking a supplement, contact NHS 111 or seek urgent medical care. Call 999 if symptoms are severe or you feel seriously unwell. Don't wait to see if it passes. So to recap, yes, zinc overdose is possible, and it's almost always linked to supplements rather than food. Acute toxicity causes gastrointestinal symptoms fairly quickly, while chronic excess can quietly deplete your copper levels and cause more serious complications over time. If you're unsure about your zinc intake, speak to your GP or pharmacist. They're the best people to guide you. If you found this helpful, let us know in the comments. And if you have a question about zinc or any other supplement, drop it below. Don't forget to like this video and subscribe to the Bolt Pharmacy channel for more straightforward health information.